apologize.
Which one?
Either one. Either one. Both of them work. I tested them earlier.
Do I have to do anything like turn it on?
Yep.
Hello? Can you hear me?
Is it all the way up?
Hello? It was on off.
Hello.
Tell me when you're ready.
You're live.
Oh,
They don't tell me I'm live when I'm testing the mic. Thank you. This is the Baca County United meeting, and we're hosting today. We have very stiff competition from the water department in the county. They're having a big meeting. Wish I was there, but here we are. Our first guest for tonight is going to be Mayor Tyler Gibson with his co-host Tammy Newman, and they are here to present whatever they're doing.
you didn't tell me anything. It's a secret.
It's a secret.
There you go. There's 2 mics if you need it.
Oh, no, we can share. Yeah. And I think they could probably hear me without the mic pretty well.
No, recording? No. Mic.
If you don't mind, please do just for a recording.
We will.
Okay. Am I first?
You're first.
Okay. So we've had a lot of projects the last 4 years. How long has it been? 4 years. The first one I want to talk about is what we've done recently. So we just redesigned our webpage and have implemented a cell phone app that's available both on Android and on Apple. It is through a company called Aptogy, and Tammy's going to hand out some flyers for it. It has a lot of good features that we haven't had before. We are able to provide push notifications for any emergencies or any pertinent information that we want the town to know. It has all of our events for the year, for 2 years, however long we want it, and has any just good information, photos, anything that we want people to know on there. So it's been really good. It's real simple to use. It's the same service that the school uses, so our community is familiar with it. Excuse me, I'm getting over a sinus infection. So it's been really, I think, a big push for transparency for the community. What? Oh, okay. It was a pain to get. We had to go through the state servers, and I had to find all the right IP addresses. So it took months to do, but it's worth it. And I've been real pleased with the outcome. What do you think?
Oh, yeah.
Good.
I think everybody's been pleased with it
Okay.
so far.
And then another project that's been real important to me is our updating our comprehensive plan. A comprehensive plan is just a planning guide for communities to use to detail growth, to find out what parts of the town would be the good parts for growth and what we need for utilities, water, electric. Helps with any grant that you get. Our last comp plan was done in 1969, so we're a little behind. So we are working, I know Lamar's working on getting theirs updated too. So it's there's a lot of grants out there available for that, so it'll be fairly easy to do, but it's about anywhere from $90,000 to $120,000 to do. So hopefully in the next year we'll have it at least started, so we'll see.
And then we have a lot of things going on with our water department. We have gotten grants from DOLA. We've gotten grants from USDA. And it's a little over $7 million project for a water treatment plant. So it's been a long time in coming, and we actually got a little ahead on the ball with, because I know all the other surrounding communities are having the same problems we are with the water. So we are going with it. We're in the design phase right now with Element Engineering. So if anybody that's from town has noticed red lines going up and down the streets and different things, it's just a lot of surveying to get everything so that they can get all the right places and everything for the water lines. There will be some new fire hydrants also in this project. So we're really looking forward to getting this on the road. So we should go out to bid sometime, I think, in April, maybe May. And so we're going to tear up some streets for a while, but it's going to be worth it. We just got a microgrid mini grant for the electric department. If any of you know, our generators are a couple of years old. So, yeah,
How old?
they were put in the 50s. So they're very not economically sound. And at this point, we really don't have anybody around town that even knows how to operate them if we was to need to get them online. So we're looking into different things to put into the generators, if it's going to be battery powered, solar powered, or natural gas powered. So that's what the study is going to determine, what we would get to help with our generators. So they would be able to, whenever electricity goes out, we would have some backup generators for the town.
That last Worthington, that last Worthington engine was put in the mid-70s.
In the mid-70s, okay, the last one.
Yeah, just because my dad was on the council at that time.
Okay.
I remember being there in the light plant when they were putting that in.
Okay,
So that's the only reason I know that.
okay, that's good to know.
So one is only 50 years old.
So one is only 50 years old.
That's all. It's really young. It's the youngest one of them all. But no, I think this would be a very good addition to the town, to get generators that we can rely on and get up and going when we need them.
Wasn't Darwin Hanson, didn't he kind of take care of that when he was here?
Darwin Hanson and Bob McKendry, Bill, not Bob, Bill McKendry were the last two around here that could get in there and make those things operate. So we lost two very good men within a week there together, and I think there may be some men up in the La Junta area or out that way that may know how to do them, but by the time we call them and say we need help, they're 2 hours away at least to come up. So we want to get something that we can operate ourselves. So,
I think they could be fired either on natural gas or diesel. I think that was right.
I'm thinking diesel, for sure.
Because I know my dad sold them diesel fuel at one time
Yeah.
for backup.
Yeah, I know there's diesel. I don't know about the natural gas on them, but I know they're diesel. Any more questions on those projects? No? And then the nice 4-letter word thing that we call around the office. Yes.
Question on Facebook. If you do solar, would you have a large cost to disengage the power plant as it is now?
That is all in the study. That's what the study is for. That's what we got the grant for them to do the study, to see all the costs on what would be more feasible for our town. Yeah.
Good question.
Anything else? Because we are kind of running through them fast. I'm sorry if anybody online has a question.
I'm sorry, I missed that.
I know you're out there just gadding around. Okay, we'll go on to our next one then, and that's our pool project. This one's I've been working on ever since I started, because our liner had met its capacity. It needed to be replaced 4 years ago. So this winter, we got a designer engineer, told us what it would cost us to, put in a brand new pool, and what it would cost us to renovate the pool that we have. So we went with the renovation. Pools are ridiculously expensive, but it's a very good project for our town, because that's what our kids had to do during the summer. So we ripped out the liner. It took the guys several days to get that liner out, but we got it out, got everything cleaned up. They have came in already and they have sandblasted it. This week they should be back to start working on the plumbing. There was a lot of plumbing issues with the pool, so they're going to be doing the plumbing, fixing the cracks that was in the concrete of the pool. And then after we get everything all fixed up and ready, then they just need some warm weather, 70 degrees or thereabout for a few days, and they're going to paint it. And then they'll be getting everything kind of put back together. So we should be all set for swimming for the start of the season. So we should be good. We was hoping to raise enough money and get enough grants to also do the bathhouse, because it needs to be ADA compliant. It really needs a lot of updates. But at this point, we just don't have the funds to do that. So we have applied for an LPMR grant for $100,000 to kind of help, because we have an LWCF grant, which is a 50-50 grant that we are doing the pool with right now. So half the LWCF, half the town on that one, which we've had some wonderful fundraisers. And I will let Tyler talk to you about the fundraiser that we just did over the weekend and the success of that fundraiser, which I am so thankful to the town and everybody that donated stuff and came out to it. It just makes my heart. I know that everybody's behind the pool for the kids, and this project for this weekend, the fundraiser just proved it. So,
Probably 6 months ago, Jeremy Gooch, who owns Baca Foods, approached me about this idea, where he said that his parents had done in Kansas before, which was a dueling pianos group, to come and have a fundraiser. And I kind of said, yeah, sounds cool, and went on my way. Well, he kept coming up to me and kept approaching me, and I said, okay, we'll do it. And I'm with Tammy. I got to say, the overwhelming support from the community, it was something new, it was something fun. People from all walks of the community were there, and they all loved it. We raised just under $18,000 that day on Saturday, and it's all thanks to everybody in Baca County, honestly, not just Springfield. We had Violets 4-H there helping serve the food, all the wonderful donors for the auction items throughout the county. Schroeder's donated an airplane ride. A gun was donated from Pheasants Forever. We just had a ton of good stuff donated, and yeah, puppies. It was a good time.
Avalanche tickets.
Avalanche tickets.
Colorado
So
Rockies. No, Colorado Rockies.
okay, yeah. So yeah, I just want to echo Tammy's statements and saying that we appreciate the support and generosity of the community for this last weekend.
Any questions?
I just want to make one comment. I want to apologize. A bunch of us weren't there because we have Lions Club bingo, and I don't want you to feel like we didn't care or weren't involved, but what an awesome community. We're the same way through the Lions Club. Every year we do our toy drive, and every year we're funded. So thank you to this community.
Any other questions or anything else you want to know? Any other questions or anything else you want to know what the town's up to? Uh-oh, here we go.
Paved roads. Is that a subject for a next couple of years we may be looking into?
Are you talking about the roads that are already paved or roads that are not paved as of yet?
Both.
Well, roads that are not paved as of yet, but if you've got a dirt road, that by ordinance, you have to get the majority vote of the people on your block that would be serviced to that road. And you have to go to a vote of those people, and they have to agree that they want a paved road because it will go on to their taxes. So the people of that dirt road that would be paved, the people on those blocks will be paying for that over the next few years for a paved road. Yeah. Now Brett he knows we've got some pretty bad roads, and he was trying to start to work on it, but there were several other projects that just got in the way last year before it got too cold. So he is going to be, as soon as it warms up, he will be starting patching and repairing streets that are already paved.
So I noticed, like on my road, that the pavement is breaking up, or the the pavement is actually breaking apart. So is there any thought about like repaving that over, or, because patchwork only lasts
And
X amount of time?
that one we would have to get Brett to see what his plan is on all of those. Yeah.
Back, excuse me, back on the pool liner, what is that made of? Is it fiberglass?
The pool, we did have a liner,
But-
and we ripped all that out, and it's going back to what it was when it was first built in 1975. I'm gonna stick that on my nose here about 2 minutes.
You said you're getting a new liner for it, right?
No,
Well, you're
no.
not, you're just redoing the concrete on it.
Right.
Okay.
Right, we're going back to the original, the way it was when it was built in 1975. Yes.
You'll notice there's a recurring theme here that all of our stuff is outdated. So we are working hard to get them all updated, or at least, brought to where they're serviceable. So it's been a challenge. We've had a lot of good luck and good work the last 4 years. So we hope to keep continuing that. And like Tammy said, we only have so much money. So, Carmen, to your question about paving roads, we had a road guy come down and look at milling up Cedar Street. Cedar, yeah.
Yeah, all the way down. that
By
cheap
the
box.
school to have that road repoured about a 3-inch pour. And just those 3 blocks was 100,
It's only 2 blocks.
2 blocks, 150,000 just for 2 blocks.
Yeah.
So we just need a really generous donor.
Yes, we do. For a lot of fundraisers.
We have another question online. Is there a way to see how much the taxes would increase to have some of these dirt roads paved?
By ordinance. By ordinance, you couldn't. You have to do the other way. My understanding by the town ordinance, you would have to do it with the people that are within those blocks are the ones that would be paying for that.
Is there a way to find out?
To find out how much the taxes would increase.
Oh, well, like Tyler said, for just 2 blocks, it was about 150 grand for a 3-inch asphalt. So, depending on how many taxpayers you have on that block, how long it would probably take, breaking it up. And I want to say the last one was 10 years, that they paid for it for 10 years. So,
And could they get grants to help offset that?
I don't know of any grants out there to do that, but we can look into that.
There's a few grants through the READY program, but the problem with those is that they require your roads to be engineered, which adds another 50,000 to your cost. So, yes, not that engineering is bad, but it just adds more cost.
Thank you.
Thank you.
So we had a drawing. Steve drew Tammy Newman. And so Tammy, if you would like to come up and get something off this table.
All right, thank you.
What'd you get?
I got a $25.
Ooh, Longhorn Steakhouse. Never been there.
All right.
You'll enjoy it. It's a nice place to go.
I've heard nice things about the Longhorn. All right. Our next guest speaker is Megan Hillman. Did I say that right? She is the clinical advisor for Southeast. Is that right? I'll let her explain what her job is and how she helps us.
Thank you. Do you want this back and I'll take the other one?
Is it
There's
still?
one right here. Yeah. Okay. Can you hear me? Is this on?
Yeah, turn it all the way up.
How's that?
Perfect.
I'm Megan Hillman. I am the clinical advisor to the Southeast Regional Healthcare Coalition, or SERHCC as we call it. And I'm also the public health director for Prowers in Kiowa County. And I'm a physician associate or assistant, depending on who you ask. And that's my longest career of about 25 years now. So I came to public health in 2018, and that was the second year, I believe, of Colorado having these healthcare coalitions. Ours here, there are 9 in the state, and ours encompasses Crowley, Otero, Baca, Kiowa, and Prowers counties. And the core members, I wrote it down because even though it's been the same that whole time, I always leave one out. Core members or required members are emergency managers, public health directors, acute care hospitals, and EMS, so ambulance services. And what we do is we try and plan ahead for if there's a disaster in our region or in a hospital or a weather event, etc., how are we all going to band together? We pre-plan these things for when our local plans aren't enough. And we are there to support each other. In COVID, we helped with supplies if you were, out of personal protective equipment and it wasn't going to come for 3 weeks, we had a cache of those supplies to be able to loan you until yours came in. And we still maintain that today. We also plan for, and these are things you don't think about down here, but we plan for chemical, biological, radiological, nuclear, and explosive events, full well knowing that we don't have a lot of resources down here, and a lot of our planning is hurry up and wait for someone bigger and badder to get here, but there are some things we can do to support each other in the meantime. My role as clinical advisor is that I look at things from a clinical point of view along with an emergency preparedness training background. So I look at a plan and I think, okay, is there anything medical or clinical that is being left out? Because sometimes the people that are the experts in writing out those plans are not medical people. So I look at that. I also look at how can I support our hospitals in particular, but we also have hospice agencies and other entities that I am paid by the coalition, a little bit of our budget, to do things like this. So I will attend any meeting to talk about issues from a medical and EPR or emergency preparedness standpoint. And I also am available to review plans. My most recent plan I reviewed was for Arkansas Valley Hospice, their emergency operating plan, which most entities have. Like, okay, if this happens, we are going to do this. Communications, things like that. Thinking about things from an operational standpoint of your day-to-day business is a little bit different sometimes than thinking about the medical illness component, or is everyone going to have their oxygen, or all of these other little pieces. And so that's my role. And also I advocate for providers who don't have a lot of time to always contribute their efforts to this work, so I can be a voice contributing in that way as well. Just a quick history. Colorado started their healthcare coalitions in 2017 with federal dollars. Prior to that, we had local healthcare coalitions, and some of those are still ongoing. And this funds our region now, and they basically defunded the local ones. So if you have a gathering of people locally, be grateful to whoever provided the lunch, because now no one's giving you money to get that work done. And the clinical advisor position was put in place, I think in 2019 was the first year for that. And I've served in that capacity since it started for our region. Anybody have questions?
So in Baca County, our public health nurse, we don't have one. So how does that impact coalition because in prior years we had meetings planning, and that has kind of fell since there's no representative anymore.
Sure. We definitely have great participation and work very well with your lovely emergency manager and Southeast Colorado Hospital District. And so those players are important. And also public health does participate in those, and particularly more from the emergency preparedness operational pieces of things. They are required to attend just like anybody else. Without a nurse there, I know that Southeast Colorado Hospital District steps in a lot to help support public health issues down here. And also the Healthcare Coalition could always be a support. I'm always available for advice, whether it be just, how can the coalition support us in this medical issue, or if they had a strategy issue down there, I'm available for that.
Our interim director has done a really good job here in Baca County too. Mm-hmm. She does participate in our meetings. When we had an emergency for our storm just a few weeks ago, she was very active in calling around and keeping us up to date. So it's not like we don't have anyone.
Right.
We just don't have a public health nurse at this moment. We've got an intern.
Correct. And there are contracts that Baca County Public Health has with the state of Colorado. Some of those are emergency preparedness responsibilities on the behalf of public health. And so she has to meet those deliverables just like any other health department.
Okay, from online. Hi, Bernie Alvarez from the Baca Home Care Agency. I would be interested in helping the elderly be emergency ready. I do this already to notify our clients of adverse weather to make sure they have extra oxygen, etc.
You could definitely join our healthcare coalition, and probably getting in touch with Steve or Phil, who is our coalition coordinator, would be the right people to reach. And Steve, is his SCRHCC, I'm trying to think of his email off the top of my head. Phil's, do you remember Phil's email off the top of your head?
Not. It is SCR.
It's something, but
yeah.
You can also get in touch with Steve, and his email is... That's
right. I'm S. Sanchez, SSANCHEZ, at SECHOSP.org. And Bernie, you can just give me a call and we will send you an invite and an application if you want to come this first time and just see what we do, or you can view online as well. To be an active member, though, you do have to participate at the meeting. The next one is close. It's in Lamar, Colorado, and it will be the second Tuesday of this coming month. So you can do it virtually, but to be an active member, you have to have bottom in seat. So if you want to participate, you can participate online, but we do have some covenants that basically say we want people to come and to get involved because,
there are rewards for that as
yes,
well.
There are.
Financial rewards for
Yes,
participation in an active manner. So it is worth your coming. And we do have, while there are the required players, Colorado also informally adds a fifth core member, which is behavioral health. So we have those participants, but we also have hospice agencies, small clinics, nursing homes. We have a variety of different people that join. I think the Alzheimer's Association joined us. There are several other agencies. And so the more perspectives you get, the better you do. And then come the April meeting, I should have a nice update. I got a scholarship to attend a rural EPR summit in Cleveland, of all places, at the end of March. So I'll be there, and then hopefully I can bring back some even more important things that we can add to what we do and better ways for us to collaborate. I think in a lot of regions in Colorado, that's an uphill battle. But I think in the Southeast region, we all know each other. We all help each other. There's not really that relationship building piece, I don't think. I mean, anybody called me, no question, we would figure out how to help. Or if Jen needs something, she calls another EM in her area. Or it's just a kind of an unwritten rule. And it's almost funny to put it down in writing in some of these plans because we all do it already.
So our next meeting is March 11th. It is in Powers County. And as far as I know, do you know exactly where that meeting is yet?
I'm guessing at the senior center, but I'm not positive.
Yes, we've done them at the senior center. But if anyone is interested, please contact me and I will make sure we give you a destination and an invite.
Any other questions?
I just put both emails into the
Oh,
chat.
perfect. All right, thank you. And if you think of something, you can always email Steve and he'll pass it along.
Thank you. Well, Steve has been back there drawing names, and Everett Bresendine, you have won a gift.
It's to talk.
Yeah, right before you talk. I'm going to talk before you, if that's okay, Everett. Okay, my name is Carmen Wilson, and I work at Southeast Colorado Hospital District, and I have worked for them for over 26 years now. One of the things I'm going to talk about, or the only thing I'm going to talk about, is the HTP program, and I'm going to focus on two areas. But the very first thing I wanted to clear up was the fact that my husband this morning said, I'm not sure what the real difference between Medicare and Medicaid is. And so Medicare is for the aged insurance, disability, black lung, kidney transplant. That is what that is. It's an insurance for the elderly or the disability. But if you don't have 10 working quarters, you may not qualify for Medicare. And we have had a few people that were in their 70s who didn't realize that their bosses didn't pay their Social Security or their Medicaid tax, and they did not get the aged insurance. Now, there's three types of Medicare. There's hospital, Part A. Part B is the provider insurance, and Part D is the newest, is the medications. Now, you have to pay for Part B and Part D, but Part A, if you qualify, automatically comes along. Now, Medicaid has several different pieces, and it is usually for people between 0 all the way up to 64. And it is also an insurance, and it varies based on income, need. They have lots of different plans, like you may qualify for someone to come in and help you with your home. Just depends on what you need. And some people have Medicare and Medicaid, but it will not pay for your primary insurance. It may copay, but it will not be your primary insurance. But for the younger people, it can be their primary. One of the things I want to tell you about Medicaid is in 2022, 57% of the adults in Colorado between age 18 to 64 were on Medicaid. There is a lot of people that have maybe lost their Medicaid, maybe they've gotten a better job, but the other reason would be is they didn't refile, and so they may not actually have insurance at this time. Also, we have seen that there are some people that don't think they qualify for Medicaid, and they would, and they are paying for insurance through their jobs, but they have like 5 or 6 people in the family, they have a lower paying job. So really, instead of spending money for insurance, they could be spending it on clothing, food for the family. So it's always good to check to see if you qualify if you feel like your income is on the lower end. The one thing I want to talk about is, I'm going to tell you first a little story about my daughter, my son, and my father. Many years ago, when my daughter was about 11, she and my son were playing out at my dad's house. And Grandpa is in the house. And my daughter and my son are out playing, and my daughter gets stuck in the cattle guard. Now, she is upset. The 9-year-old is like excited. He's like, oh, right, what are we going to do? And she's like, you need to go get Grandpa. I can't get my leg out. And he's like, okay. And he starts to run off, comes back, and he gives her 2 rocks. And he says, this is in case the coyotes come to eat you. And that only upset her even more. Then he runs up to the house and gets Grandpa. And on the way back, my dad is saying, well, we may have to cut the leg off. And that even excites the 9-year-old a lot more. And he races down to his sister to inform her that they may be cutting the leg off, which makes her cry some more. Now, you may wonder how I'm going to link this. One of our initiatives in the RAY is introducing you to the regional accountability entities, which is for the Medicaid person. So, like my daughter, a lot of people will find themselves, they don't try to use it, or if they do, they go to the ED, they don't have that primary, and they get kind of stuck in that cattle guard. They don't know how to get out of it. And they need services. And the doctors are trying to refer them out. And it actually is very hard for our primary doctors sometimes to get the care from other physicians, other specialties, because they're Medicaid patients. And the Ray is kind of like the Grandpa. They're sitting up there, but they have no idea that you're stuck in the cattle guard. And the only way that the Ray can help you is if you give them a call and say, hey, my doctor has tried XYZ. We have had people who've needed hip surgeries and can't get on for 6-7 months because the ortho person is like, okay, I only take 5 a year that have Medicaid. You are on the next year's list behind 200 other people. But the Rays are designated by the state to help you find those resources. They are a lot bigger than our doctors. They have a lot more out there to help us. And they can get things done that we can't always do for you. And so we want to make sure that our Medicaid population knows that there's a Ray, that there is a number for them, that there is help out there. People who are on Medicaid may be, in substance use disorders. And that leads us to our next project. We're working on something called ALTA, which is the alternative to drug use or opioid use. And so what we do is we give alternative meds, things that will not trigger cravings, change the brain chemistry. So we do not help people get addicted. 20 years ago, right after I got out of nursing school, it suddenly became pain was like the sixth line. You couldn't have pain. We can treat it. It was all based on somebody way above us. There's a lot of underlying factors, but it was really promoting greed. No concern with the patient. We all know that you break a bone, you're going to have some pain. You cannot be pain-free. But they sold the people that you have to be pain-free, and so in looking for that need, we ended up having a lot of addiction. So we at Southeast Colorado, our physicians, when you come into our ED, they may not give you any opioids because their job is to keep you safe. They are working hard to improve your care. and they're not going to give you any unnecessary opioids. And these are two very big projects that we're working at our hospitals to improve the care of all of Baca County and all our Medicaid patients. And when we find resources for Medicaid, we usually can tie them into everybody. We find free resources for mental health that affects farmers, that affect school kids. So we want a very healthy community, and in Southeast, we are trying to provide that and get the message out to all our constituents. Any questions? Quiet bunch.
Did you draw?
You draw?
I sure did.
Megan Hillman. All right. Woo.
You're getting on the table, man.
Right. So Everett Brizendine is our last speaker. He is the new coroner, and he is going to talk about the changes and how that may or may not impact us and what he needs from our community.
Everett, we love having you.
Thank you. You need this one.
You know, I might have a question.
Okay, I believe I'm on now. She said they love having me. I was fascinated by the way she referred to us people who are aged before. Have been appointed to fulfill Dr. Morrow's term. After about 40 years working with the coroner's office, Dr. Morrow decided that it was time to step down as the head coroner. And so on January 1, 2024, I became the Baca County coroner by appointment from the county commissioners. So there have been some changes. Steve contacted me and asked me if I would be willing to do a short presentation. And I told him that I had no idea what I could say. I was running out of things to say because I was here a short period of time ago, and I didn't know what I'd say. And he said, "Oh, you'll do fine." So I went home and was visiting with my wife and said, I just don't know what there is that I can add to what I said last time. And she said, "Oh, honey, I've seen you talk for an hour and never say anything. You don't have anything to worry about." So I have put it together a little bit here that hopefully won't take too long. Dr. Morrow has agreed to stay on as deputy coroner, so he will be working with me and helping us out and providing a good amount of the information and the labor, the work that we put together for the coroner's office. And in addition to him, we have 3 other coroners. One that we just added, we added Kevin Johnson as a deputy coroner. So Kevin will be helping out the coroner's office. And then in addition to Dr. Morrow, Dennis Carlson and Stacy Bishop are deputy coroners that will be also covering. So we have those, and then in addition to them, we have Becky, my wife, who is working with us, and also Dolly Morrow, who primarily will be doing victim advocate work. We run into things every once in a while where we need some assistance, where we have a long time recovering a body, or maybe we have somebody who has died at the hospital and they left little kids behind. And in those cases, we really need somebody to step in and provide some emotional support, as well as helping give some advice and guide people through the death and grieving process there for that period of time when they're in our care and under our contact. So those are some things that we will be doing. As with those people, we will have them doing those things for us. Other than that, there's not going to be a lot of change. We have added some new contact information and stuff like that, if you need to get in touch with us, you can go through the sheriff's office at any time and they will contact us, but we want to be available when we can help people. I wanted to provide just a little bit more information about what the coroner does and what people's responsibilities are and what you can expect if you have a sudden death. And one of those that I wanted to emphasize a little bit is that if EMS is called to a scene where somebody has, you believe, died, they are required to begin resuscitation unless there is an obvious sign that it's futile. And many times those signs take up to 30 minutes to develop. So your loved one may have been deceased for 30 minutes. If they're underneath warm covers or something like that, it may take longer. And EMS is still required to begin resuscitation efforts. So it's very important that you let your desires be known as to what you want done and how far you want people to go if you die. And I have 3 forms up here this evening that are just samples if someone wants to look at them or if somebody needs direction. The Colorado supplies a form that they call the MOST form. It's the one that our hospital uses, and it's very good. It gives you options as to how much care you want given if you are in the place where you're unable to make those decisions or make your will known on that. Do you want CPR or do you not want CPR? Do you want full treatment? Do you want life-sustaining treatment? Do you want life support? Or do you want just comfort-focused care? It's all included on that MOST form, and it's a very beneficial form. I call it a DNR order. The second one is called an advanced directive or a living will. And for that one, it's a very short form, easy to fill out, but it gives you options as to what you want done and what your will is with regard to life support. It also will allow you to appoint someone to be your medical durable power of attorney. So on a living will, it can consist of a lot of things, but that is the second form. The third one is just a medical durable power of attorney, and it is very brief. It just says, I so-and-so give this person the power to make all medical decisions if I'm unable to do so. And it's very short, it's very to the point, and it's easy to fill out. So those are some things that I think we should be considering, especially if we have a loved one that's not in very good health or someone that has a terminal condition. Make your wishes known, it's important. The next thing I wanted to speak about just briefly is organ donation. Back in, I believe it was 2017, the state of Colorado passed a law that states that if you die in a hospital, then the hospital staff are required to contact an organ procurement organization and give them all of the information of any contact that they know for that patient and give them all that contact information so that the organ procurement company can contact them and try to encourage them to do organ donations. Even if you, at the point, say, no, I'm not an organ donor, I don't want to donate my organs, and your family says, no, we don't want to donate our organs, the hospital is still required to contact a procurement agency and give them your contact information so that they can call you and try to encourage you to do that. It makes it very difficult, but if you're that person that's in there sitting beside your loved one and the hospital staff is asking you these questions and here the organ procurement organization is calling you and asking questions, it can be something that is very difficult to work through and makes people very upset. They are required to do that by law. They can't get away from it. Now, if they may be able to say that there are things that keep you from being an organ donor, and they may not be contacting you. But according to that law, they are required to notify the agency and give them the contact information for somebody. So if the hospital does that, don't be offended. They're doing their job. According to that law also, all coroners are required to work with a procurement agency to do their best to ensure that all persons who are eligible for donation are contacted, or their family members are contacted and given that option. So that's one thing that we have to look at, and it makes things difficult at times to do that. But that is a law that was passed in the state of Colorado, so don't be surprised whenever they do that. Any questions about that or comments?
I had a question about how do you become a coroner?
Okay. Becoming a coroner it's an elected position for one thing, but then you have to have a medical background of some sort, and you have to fulfill, I think it's 40-hour training to complete that, and really that's about it. The training is the big thing and the background that you have, but it is an elected position.
Is that true for the deputy coroners too?
No, the deputy coroners are appointed by the head coroner, and so they don't have to fill all of those requirements. We're doing what we can to encourage all of our deputies to become certified death investigators, and we do have to have a training program to assist them in being able to do their job efficiently. So we try to get all of our coroners to have 15 to 25 hours of continuing education each year, and as well as keeping up on things and working and being involved in cases.
One more question.
Sure.
On the, you said there's a victim support person. How would someone become, is that a volunteer position? Is that something that how does that work?
It is a volunteer position. Those people are chosen by the head coroner, but it is a volunteer position, yes.
So if someone wanted to do that, they would just contact you and talk to you?
Sure, yeah, contact me. We'll see. It takes some pretty special people to do those things. We get involved in some things that are very difficult, and people see things that change their lives, that they'll never be the same again when they work with some of these situations. But yes, they would be more than happy. I would be more than happy to field any calls, and we can discuss it and see what we can do. Some other things that happen when a coroner comes that would help people is what we try to do. The first thing is we have to verify that the person's deceased, of course, and then we have to note a time of the death and a time whenever we pronounce that person, because those appear on the death certificate, and it's an official document. We may have law enforcement show up. Yes, sir.
I think your microphone might have turned off.
It sounds good.
There you go. You're good.
Okay. But we may have law enforcement respond. That doesn't mean that we feel like a crime has happened. We always try to clear it with law enforcement and ask them if they would choose to respond, because we want to clear every angle, every possibility. So if we ask law enforcement to come to your house whenever somebody's deceased, that doesn't mean that we think you did something wrong. That's just one of the ways that we try to cover all of the bases and make sure that anything that doesn't go unnoticed, if there's something there. We start gathering information and we try to determine the manner and cause of death. As I talked about last time, to do this, some of the things we need is a medical history, the event history, what was happening when this person died, if you were there with them. We try to get the medical providers' information so that we can get medical information from them. We try to get their most recent medical visits and record of that, and the list of medications, or actually take the medications. All of those to help us determine the cause and the manner of death. Sometimes we have to decide, when did this person die? If somebody wasn't there with them, we have to try to decide at what point did that person die. And those can become important with regard to insurance and things like that. The time of death becomes very important. The next thing we have to do is determine the legal next of kin. And we have had some issues there where somebody was living with one person, but they were legally married to somebody else. It doesn't matter who they're living with, who is their legal next of kin. Children can be the legal next of kin, but it's one of the things that becomes an issue at times, and we've had some hard feelings because the person said, well, they've lived with me for 5 years, how come I can't choose which mortuary they go to? Because they're not legal next of kin, and we have to, by statute, go by the wishes of the legal next of kin. So that becomes important. Then we have to notify those next of kin, which can become very, very difficult. I remember one case that I worked on that the next of kin was in New York, and we had to contact that spouse in New York who emotionally could not deal with the situation at hand. And I ended up working with a young lady that was, I think, 17 years old to work through the arrangements and what we were going to do. So those can be difficult, or one of the hardest parts of our job. After that, we get all of the information that we can for the death certificate. We try to get a name, social security number, date of birth, address, anything that will lead us to knowing what the manner of death was, which would be, was it suicide, was it homicide, was it natural, was it an accident? And those become very important because law enforcement relies on what we put on a death certificate as to what charges they can place on someone. If we don't put homicide on a death certificate, it's very, very difficult for law enforcement to prosecute that person. And the other side of that, if we do put homicide, it's very difficult for them to not come up with charges. So those become quite important. And then we either transport the body or have the mortuary transport the body to whatever mortuary that the family chooses. We cannot recommend one. We can't suggest they use this one because it's closer or whatever. That's the family's choice, and we try to be very, very neutral on all of that. We try to make arrangements. If we have a questionable death, we will make arrangements to do an autopsy. Just for information, we typically use El Paso County pathologist, the El Paso County Coroner's Office, to do our autopsies. Everyone likes to know how that works and the time frame. They've been very good to work with us, and they've nearly always will get us in their next work day. That's difficult for them, and it's sometimes difficult for us. But they've been very good about working with us. An autopsy only takes about 2 hours, but to get good results from it as far as toxicology or other exams where they have to look at the cell level may take up to 2 months. So that takes us some time, and we have to work at trying to get the good cause as far as that goes. But we will issue a death certificate as soon as we get the results of whatever, either the investigation or the autopsy. And then at that point, we can sign the death certificate. Then the mortuary that the family chooses has to request a disposition permit. And with that disposition permit, they can then either cremate or embalm. But without a disposition permit, the family can't do anything with the body. The mortuary can't do anything with the body. They can't cremate. They can't do anything. So we've got 3 days that we can take, if we have to to issue that death certificate, and then the family gets the disposition permit and they can bury, embalm, or cremate. So that's kind of the way that it works from the inside, from where we're at. And I've taken more time than I should have, but if you have any questions, I'd be happy to answer them, and we'll go from there. I'll turn it back.
Thank you. You were wonderful. And that is it for our meeting today. We have one last gift, and Becky Bresendine, it's yours. It's a beautiful sunflower. So anyway, thank you for all who joined online. Thank you all for who all came in. And I'm going to find out what they said about the water. Bye.